Okay. Notice that as I'm doing this, what we're going to call is it, again, we're moving it into a down slip. So this is our down slip mobilization, right? And we're going to do it with a level of velocity and at end range, which is why it's essentially a thrust technique, a grade 5 thrust technique. Okay. You're going to see it's not invasive, but the issue and the problem is I'm, about 10 joints away from the joint that I'm actually trying to affect. So I'm going to hold really above his ankle, but I've got to go through the knee, and depending on where I'm holding at the foot, the joints of the foot, I'm trying to go through the hip to get to the anomaly. So again, this is a technique, as far as precautions, you wouldn't want to use for somebody that has any sort of pathology in any of those joints. If a patient had a total knee replacement, we're not going to start pulling on this joint, right? So in that case, we'd have to come up above the knee. But we're going to kind of take advantage of the mechanical advantage of the length of the leg, and I'm going to basically kind of use that advantage to kind of retrieve that innominate and pull it down, is essentially what I'm doing. So I'm recruiting motion through the extremity, and I'm trying to pull that innominate on that side downward. Okay. Unlike with the hip, we want the hip in the open pack position. So if you remember, if we're mobilizing the hip, I'm going to have it about 30 degrees of flexion, a little abduction, a little ER, and that's the open pack position of the hip. In this case, I'm trying to go through the hip. I don't want to mobilize the hip. In fact, I want to reduce motion of the hip. So I'm going to put that hip in a relative, as best I can in this position, closed pack position. So I'm going to actually kind of bias him a little toward adduction, a little toward internal rotation, and I'm going to try to keep him, somewhat neutral. Not as flexed as maybe I would if I was mobilizing the hip. So the difference here is I'm not in this open pack position where I'm trying to create motion. I'm still pulling and it looks like this, but my start position is more, I'm trying to close down that hip. Does that make sense? Because I want to go through it to get to the innominate, right? So I'm kind of closing that down. Now, the position that I'm going to choose to do this is also a nice feature depending on what we're seeing. So if we have a patient with an upslip, oftentimes there's a rotation that's also present. So what we can do is we can kind of kill two birds with one stone. If I'm trying to bring this right side down and I'm trying to downslip this, and this innominate is anteriorly rotated as well, I might choose the supine position, because what I'm going to do is I'm going to bring that down, downslip it, but then by bringing him into a little bit of flexion, I'm also correcting the anterior rotation. See how that works? So depending on the position here, depending on what I'm seeing with him, I can keep him supine if I'm trying to do a downslip with posterior rotation. Right? I'm trying to move it down, and I'm trying to move it into posterior rotation. And that occurs by me flexing the hip with him supine. Okay, go ahead and line your belly. If he had a posterior rotation, and I'm trying to do a downslip and move it anterior, I'm going to have him here. So now I'm doing a downslip, but if I bring him up into a little bit of hip extension, can you see how I'm also biasing that anteriorly? So that's my kind of like, if I'm trying to anteriorly rotate it and downslip it, I would have him prone. So I can kind of combine my downslip with the rotation correction as well. So again, prone is if I'm trying to move the innominate down and anterior. Prone, I'm trying to move it down and anterior. So my terms are always describing how I'm moving it, right? So I'm moving it down and anterior, and then go ahead and lie supine for me. And with supine, I'm trying to move it down, and I'm trying to move it posterior. Okay? So it's really easy, kind of looks like this. I'm here, again, grab above the foot. I'm here like this, and kind of loosen him up, make sure he's relaxed. A little bit of IR, a little bit of adduction, and I'm here like this. Now here's what makes it a high velocity thrust. I'm not here doing this, right? So this would be a grade 1, grade 2, right? Further in the range now, grade 3, grade 4 at end range. Grade 5, see I'm at end range? That's grade 5. Now sometimes I do just one thrust, other times, I'm at that end range, and I might just oscillate into grade 5. It doesn't always have to be high velocity, but I almost try to tease it out, and then sometimes I'll give it a little bit of a pull just at the end. Okay, so you guys see that? And this is a great opportunity, actually, because you could probably even just see these grades. Grade 1, small amplitude. Grade 2, larger amplitude. Grade 3, larger but further into the range. Now watch grade 4, end range, grade 4. Right, see that? And then grade 5 is here, right there. Okay, so I'm just trying to pull that down.